While Washington works on a solution, the outbreak continues to spread and disrupt daily life. Overnight, Apple said it will close all of its retail stores in the United States and around the world outside of China until March 27th. The company had recently reopened its stores in China that were shuttered because of the outbreak there. The nationwide closure is the first among major U.S. retailers. Meanwhile, much-needed coronavirus testing is underway in one of the hardest hit communities in the U.S. Michael George is in New Rochelle, New York, with that and more of what people around the nation are dealing with. Michael, good morning.
Good morning, Michelle. This weekend brings little relief to people directly impacted by the coronavirus pandemic in their everyday lives, with schools closing, the stock market tanking, and anxiety about staying healthy. As experts warn, this will likely get worse before it gets better. Across the country, shoppers emptied grocery store shelves, stocking up on everything from toilet paper to non-perishable goods.
I knew there was going to be a line, but didn't know there was going to be a line that's go the full city block.
Social distancing has become the new normal. Millions of Americans are staying home as schools have closed in at least 14 states. Major sporting events are either canceled or postponed. The 124th running of the Boston Marathon next week has been postponed until September. 17 states have opened up drive-through testing sites for coronavirus, including here in New Rochelle, New York, which has one of the largest clusters of coronavirus with more than 120 people affected. They can test 200 people a day.
My husband's not feeling well. He's got throat symptoms. He's, achy and tired, and he works in the city.
The testing is not where it needs to be, right? The main way to slow the spread, we know from all the other countries, is to do the testing, isolate the positives.
Healthcare officials say testing delays have made it hard to contain the virus. Private sector labs, including Roche, Cleveland Clinic, and Quest Diagnostics, have developed their own tests and have now partnered with the Trump administration. Matthew Binnicker of the Mayo Clinic headed the team that worked around the clock to come up with a test kit in just 3 weeks.
We realized that the public health infrastructure wasn't going to be able to accommodate all the testing that was going to be needed, and that clinical laboratories would need to step up and participate.
But hospitals across the country are bracing for a surge in patients, while emergency rooms are already overwhelmed with people worried they have the virus.
We are probably at the tip of the iceberg at this point in terms of what we are going to be seeing in emergency rooms over the next few weeks.
And medical experts also worry if we continue to see a dramatic rise in cases, it could lead to a shortage of hospital beds and equipment like ventilators, and in a worst-case scenario, lead to rationed care. Dana?
Michael George, thank you.